Yien mithiedhogo joma guogi siwawo kayo to gi joma thuolo kayo yudore ute thieth 26 ma Siaya. Ute thieth go endo oriwo nyaka 6 manyocha ong'awe rang'iny mar level 4 kaka Urenga, Ongielo, Tingwangi to gi mamoko. Magi noyangi gi Charles Oduor mochung' ne tuoche ma ojwang' ei Siaya.
Today we had a meeting, and the meeting was supported by AMREF, and what we were discussing majorly was just about commodities, or we can call them drugs. So we wanted a way that, like for example, NTD diseases, which the ones that are found in Siaya are like rabies, which is brought by dog bites, and also snake venoming, which is brought by snake bites. We have jiggers, we have schistosomiasis, soil-transmitted helminths, and podoconiasis. So we will find that some of these diseases are focal diseases like schistosomiasis. So they are found in one particular areas. So we were discussing ways how these diseases, the commodities which are drugs or even anti-snake venoms or vaccines could be taken to these areas where through our surveillance system we are able to know that the cases are many. So the next facility where we have several cases, we just want to make sure that the commodities are available in those facilities, because most of these NTD commodities are very expensive. Like for example, anti-rabies is very expensive. For snake bites, anti-snake venoms are very expensive, and even drugs to treat bilharzia, which is schistosomiasis, is very expensive. So we want to distribute drugs to areas where we have most cases, because some of these diseases are emergency. For example, if you are bitten by a rabid dog, then it is just, we have hours where we need to intervene. Same with snakes. So we don't want the patient to take a very long time being referred to far facilities. And we were discussing modalities with pharmacists and other cadres so that these drugs and vaccines and anti-snake venoms are placed strategically in areas where we have most of these cases, and we were using our data through our surveillance system where we know the cases are prevalent and needs urgent intervention. So we have agreed with the way forward, and we are going to avail these drugs at the focal places where we have most cases of these diseases. We want to capture this data as we are treating. And if we can give example, there are several snake bites and dog bites in Bondo sub-county. So we would want to track these facilities at using modern technologies, and we'll be able to know that particular facilities has these commodities using the modern technology. And then in case there's a reduction in stock, then we'll be able to intervene before there's stock out.
Oduor wacho ni gitimo ma mondo jopiny oyud thieth mapiyo piyo kinde ma okagi gi guogi kata gi thuol. Kowacho ni kinde machon ne ji ohinyo dhi e ute thieth madongo ema ne yudo yien go endo.
Yes, so you would find that at times these drugs that treat these diseases that need immediate intervention could be found only in big facilities, but not lower facilities. So now we want to avail them in all the facilities, but more so there are some facilities that we have upgraded. So these facilities that we upgraded, there are 6, and we want to make sure that these commodities are available in all these upgraded facilities, like other facilities that were in their level, so that the community would be able to assess these commodities without traveling far, that they are looking for intervention in only the previous facilities that we used to have these commodities. So